Ever had that happen? You feel this weird pain, maybe some stiffness, and you're just trying to guess what's really going on inside.
Oh, absolutely. That wanting to see beneath the surface.
Exactly. And that's where we're headed today. We're doing a deep dive into X-rays.
Oh.
Super common. Drat. But there's a lot of cool science behind how they actually let us see inside the body.
Definitely. And for you, heading into medicine, X-rays are, well, they're going to be one of your fundamental tools. So for this, we've looked at insights from radiologists at Envision Radiology, some specific chest X-ray info from the Global Tuberculosis Institute,
Right.
the anatomy resource Teach Me Anatomy, and general stuff from Mayo Clinic and Patient Image. Pretty comprehensive.
So the mission today.
The mission is really to give you a solid foundation, not just what an X-ray is, but crucially when you'll actually use it and what it can tell you.
All right, let's jump in. X-rays. We all know the word.
Yeah.
But, what are they fundamentally?
Yeah, good question. Think of them as a kind of light, like visible light, but with way more energy. And it's this energy that lets them pass through softer stuff in our bodies. Their discovery was one of those great science moments. Wilhelm Röntgen, back in 1895, apparently one of the very first pictures he took was of his wife's hand. You could see her bones, even her ring.
Wow, that's amazing. Imagine seeing that for the first time. So how do we get from that discovery to the images doctors use now?
Okay, so it starts with electricity. A high voltage generator powers up this thing called an X-ray tube. Inside, there's a part called the cathode with a tiny filament.
Like in a light bulb.
Sort of, yeah. It gets heated up, and these little particles, electrons, they kind of boil off. Then, bam, they're shot across the tube at really high speed towards the other end, the anode.
Okay.
That anode is usually made of tungsten. And when those super fast electrons smash into the tungsten atoms, that collision releases X-ray photons. That's our special light. And we can control the energy, like how much punch these X-rays have, using a setting called KVP. Higher KVP means they can get through denser materials better.
So you create this beam of X-ray energy. It's aimed at the patient.
Yeah.
Then what? How does it become a picture?
So the beam goes towards the body part we're interested in, and on the other side of the patient, there's a detector. Used to be actual photographic film.
Like old cameras.
Exactly. Now it's mostly digital detectors. As the X-rays pass through the body, different parts absorb different amounts. Bone, really dense, right? It blocks a lot of X-rays.
Okay.
Air, like in your lungs, not dense at all. Lets most of them straight through. Soft tissues, fat, muscle, they're somewhere in between.
So the detector just records how many X-rays hit each spot.
Pretty much. It captures that pattern. Lots of X-rays hitting means it shows up dark or black. Very few getting through means it shows up white, and then you get all the shades of gray in between.
Got it. White is dense. Black is not dense, like air. Simple enough. But I know doctors often order, like, a front view and a side view. Why isn't one picture enough?
Ah, yeah, that's key. Because a single X-ray is flat, right? It's a 2D picture of a 3D structure. All the depths are squashed together. Think about it like seeing only the shadow of something. You lose all the depth information. Taking pictures from different angles, like front and side, helps us mentally reconstruct that 3D shape. Crucial for seeing exactly where a fracture is or if a joint is truly dislocated.
Right. You need that spatial context. Makes total sense. Okay, so we know how they work, how images form. Now, for you listening, the big question: when do you actually order an X-ray? What are the main triggers?
That's absolutely fundamental. You'll generally think about an X-ray when your physical exam isn't giving you the full picture and you need to see inside, especially when different tissue densities are involved. Let's walk through some common scenarios you'll definitely see.
Perfect. Let's start with injuries, the obvious ones.
Right. Acute injuries. Someone falls, gets hit, you suspect a broken bone. X-ray is the go-to. You're looking for that dark line, the fracture, breaking the smooth white outline of the bone. Same for a suspected dislocation, where the bones in a joint are knocked out of place. X-ray shows that clear misalignment.
What about sprains, though? Like twisting an ankle?
Good question. Usually for a mild sprain, an X-ray isn't needed because ligaments and tendons don't show up well. It's mainly for bone. But if the injury is severe, lots of pain, can't put weight on it, then you might order an X-ray just to rule out a fracture because the symptoms can sometimes overlap. So think X-ray for significant trauma where bone damage is a real possibility.
Okay, breaks, dislocations, ruling out breaks and bad sprains. What about problems that aren't sudden injuries, like persistent pain?
Yeah, absolutely. No. If someone has trouble walking or moving a limb and it's been going on for a while without a clear injury, an X-ray might pick up something like a stress fracture. Or persistent swelling around a joint could be fluid. maybe subtle signs of infection near the bone, or an underlying fracture. And for things like arthritis, that chronic joint pain and stiffness, X-rays are great for showing changes like narrowing of the joint space, those bony spurs.
Yeah.
You can track how it's progressing.
Makes sense. Now, what about things not related to bones or joints? Chest x-rays seem really common.
Oh, incredibly common. If a patient comes in with breathing problems or chest pain that won't quit, a chest x-ray is often one of the first things you'll do.
What can you see there?
You get a look at the lungs, the heart, the major airways and blood vessels. You're looking for signs of pneumonia areas that look denser, wider than the surrounding air-filled lung. Maybe signs that suggest lung cancer or TB.
Okay.
You can also assess the heart size. Is it enlarged? Is there fluid building up in the lungs, what we call pulmonary edema? That shows up too.
You mentioned different views earlier. Is that true for chest x-rays too?
Yes, usually two standard views. PA, which stands for posterior anterior, the beam goes from back to front, and a lateral view from the side. The PA gives a good general overview, and it's typically taken from about 6 feet away to reduce magnification distortion. But the lateral is super important because it lets you see things hidden behind the heart or near the diaphragm on the PA view.
Gotcha. So two views give a more complete picture of the chest. Are x-rays used for, say, stomach problems too?
Sometimes, yeah. If someone has trouble swallowing or certain kinds of tummy pain, you might do what's called a barium study.
Barium.
Yeah, the patient drinks this chalky liquid containing barium. Barium is really dense, so it shows up bright white on the x-ray and outlines the esophagus, stomach, intestines as it passes through, helps spot blockages or ulcers.
Ah, okay.
And of course, if you suspect someone, especially a kid, has swallowed something they shouldn't have a coin, a small toy in x-ray is usually the fastest way to see if it's there and where it is.
Right. And I know they're used for screening too.
Definitely. Mammography is a big one. That's a specialized low-dose x-ray for breast cancer screening. It can pick up tiny changes, often years before they can be felt.
True.
And dental x-rays. Everyone's had those, right? Checking for cavities between teeth, looking at tooth roots, checking the jawbone health. Really routine, but important.
Okay. And lastly, I guess, checking up on how treatment is going.
Exactly. Monitoring, got a broken bone in a cast. You'll get follow-up x-rays to see how the bone is healing, make sure it's lining up right.
Makes sense.
Or for chronic stuff like arthritis, you might get x-rays periodically to see if the joint damage is getting worse or if a treatment is helping slow it down, or tracking a foreign object that maybe couldn't be removed right away. So yeah, not just for the initial diagnosis, but for follow-up too.
Okay, so we've got a good handle on when you'd order one.
Right.
Now let's dive into what these images actually show you. As a future doc, what are you looking for?
Right. So on a bone x-ray, you're obviously looking for fractures. Where is it? What type is it? Are the pieces shifted? But also signs of arthritis, like we said, narrow joint space, bone spurs, maybe deformities,
Yeah.
just general alignment issues.
And zooming in on that chest x-ray again, what are the specific findings you're trained to spot?
Okay. Chest x-ray interpretation is a huge topic, but some key things. You look at the heart shadow. Is it too big? Suggests heart failure, maybe. You look at the lung fields. Are they clear and black, meaning full of air? Or are there hazy white areas suggesting fluid or inflammation, like pneumonia? We look for specific patterns. Widespread little lines or dots might mean interstitial lung disease. A distinct round spot could be a nodule or mass, possibly cancer. Need more investigation, of course.
Right.
For TB, you might look for scarring or even cavities, often in the upper parts of the lungs. We check the central area, the hilum, or the lymph nodes there enlarged. That can indicate infection or sometimes malignancy.
Okay.
You can sometimes see cysts, dark air-filled pockets. And then the edges, the pleura, the lining around the lung, is there fluid there? That's a pleural effusion. It looks like a dense white area, often with a curved top edge if the patient is upright, the meniscus sign.
Wow, lots to look for.
Yeah, and it's important to remember, like with TB, the x-ray shows signs consistent with it, but you need other tests to know if it's active. It's a snapshot.
Got it. And those dental x-rays, what are dentists spotting?
Primarily cavities, especially those hiding between teeth. Also problems at the root, like infections or abscesses. And the health of the jawbone itself, any bone loss, impacted teeth, things like that.
And foreign bodies. Pretty straightforward.
Usually, yes. If it's something dense like metal or even some plastics or glass, it'll often stand out really clearly against the softer tissues, makes it much easier to locate for removal.
Okay, clearly x-rays are super useful. But everything has pros and cons. What are the big advantages that make them so common?
Well, speed is a huge one. An x-ray is quick, Takes just a few minutes. Very convenient for patients in busy clinics.
Yeah.
They're fantastic for looking at bones. Still the gold standard for fractures, really. And cost generally much cheaper than a CT or MRI scan.
That's a big factor.
Definitely. Plus portability. You can bring mobile x-ray units right to the bedside in the ER or ICU, and they're just versatile, useful for so many different things. Chest, bones, abdomen. And the radiation dose, while not zero, is generally lower than a CT scan.
Okay, those are strong points. But what about the downsides? What do you need to keep in mind?
The main limitation is soft tissue. Muscles, ligaments, tendons, organs. They all have similar densities, so they don't show up with much detail on a standard x-ray. It's
Yeah.
hard to tell them apart.
So if you suspect a torn ligament.
Exactly. An x-ray probably won't show it directly. You'd likely need an MRI for that. Then there's the radiation. It is ionizing radiation. The dose from one x-ray is low, the risk is small, but it adds up over a lifetime.
Right, the cumulative effect.
Yeah, so we always follow the LAR principle as low as are reasonably achievable. Get the image you need, but use the lowest possible dose. You always weigh the benefit of the information against the small risk of the radiation, especially if someone needs repeated scans.
Okay.
Oh, and it's worth noting that digital x-ray systems, which are common now, generally use less radiation than the older film systems.
Good to know. So, great for bones, fast, cheap, but not great for soft tissues. And there's that radiation factor to manage. How do they stack up against, say, CT or MRI? Just briefly.
Good comparison. So, CT also uses x-rays, but it takes lots of pictures from different angles and uses a computer to build cross-sectional images. Much better detail for both bone and soft tissue than a plain x-ray. The trade-off: higher radiation dose.
Okay. And MRI.
MRI uses magnets and radio waves, no ionizing radiation at all. It's fantastic for soft tissues, ligaments, tendons, brain, spinal cord, but MRI scans take longer, they're more expensive, and some people can't have them, like those with certain pacemakers or metal implants.
Right.
And then there's ultrasound. Uses sound waves, no radiation, great for looking at soft tissues, blood flow, fluid. Think pregnancy ultrasounds or looking at the gallbladder, but it doesn't see through bone or air very well.
So it really depends on what you're looking for.
Exactly. As a doctor, you learn which tool is best for which job, considering the clinical question, the body part, cost, radiation, availability, all of it. If you suspect a torn knee ligament, for example, MRI is usually the way to go first because of that soft tissue detail.
This has been super helpful, really clarifying. So just to wrap up, what are the absolute key takeaways about x-rays for someone learning the ropes?
Okay, key points. X-rays use electromagnetic energy. Images are formed because different tissues absorb that energy differently. Dense stuff like bone blocks more, looks white, air blocks very little, looks black.
Got it.
They're excellent for bones, fractures, arthritis, alignment, very important for chest evaluation, lungs, heart, fluid. Good for finding foreign objects.
Sound correct.
Fast, usually inexpensive, often portable, big advantages. But limited detail for soft tissues, and they do involve radiation, so always use them judiciously, following that LRO principle. Understanding these basics will really help you know when an x-ray is the right first step.
Definitely. It's been a fantastic deep dive into such a fundamental tool. You know, with imaging tech moving so fast, it makes you wonder, doesn't it? How will the role of the basic x-ray change? Will it always be this essential first look, or will newer things eventually take over? Something to think about as you continue your medical journey.
That's a great question. And for all of you listening, if you want to build on this, maybe look into specific types of x-ray studies like fluoroscopy, where you see things moving in real time, or start looking at more examples of x-ray findings for different conditions. That foundational knowledge is invaluable.